Yes, sir. We will start, sir. Good morning, one and all. I am Shilpa, Assistant Professor ECE, GRIT. Would like to welcome you all to the 12th session of Day 5. That is last day of our FDP on artificial intelligence impacts on telemedicine. It is my immense pleasure to welcome Mr. Dilip Kumar Yadav on his talk on AI-based detection and tracking in telemedicine and health services. In this regards, a small intro about Dr. Yadav's profile I would like to read out. Dr. Dilip Kumar Yadav received the engineering degree in CSC from Uttar Pradesh Technical University, Lucknow, UP, India. Dr. Yadav has earned master's degree MTech in Computer Science and Technology from School of Computer and System Sciences, JNU, New Delhi, India. Dr. Yadav has earned PhD in CSC degree from School of Computer and System Sciences, JNU, New Delhi, India. His primary research interests are in image processing and computer vision using machine learning and artificial intelligence. He is the author for more than 45 research publications. Dr. Yadav has published 3 patents. He is also an author of 2 books and 3 book chapters for national and internationally reputed publishers. He is also a Sun certified Java programmer for Platform 1.5. Dr. Yadav is also associated with many international journals as associate editor, member, or international editorial board member, etc. He has more than 12 years of working experience in industry as well as academia. Currently, Dr. Yadav is working as an associate professor in Department of CSE, Golgotia University, India. Welcome you, sir.
Yes, ma'am. Very good morning. Good morning to all of you.
Sir, you can start screen sharing, sir.
Ma'am, okay, sure. Ma'am, have you given permission for sharing the screen?
Yes, sir. Yes, sir. You can share the screen. Your co-host.
Okay.
Sir, is there any problem for sharing the screen?
I am sharing.
Okay.
Actually, earlier I want to share through the mobile, but there is no option to share the screen in the mobile. That's why I started it on laptop.
This meeting is being recorded.
Hello.
Hi,
Hello.
sir.
Sir, one message is coming from at my end. Host disabled participants screen sharing. So please allow.
We'll make it, sir. Please, please.
Okay.
Sir, I have made another account also as co-host, sir. You can share from that account also, sir. Sir, I think the option is enabled now.
Yeah, your screen is shared, sir. It is appearing.
Hello.
Ah, yes, sir. Dilip, sir.
Yes, sir. Yes, sir. Now is it visible?
Oh, yeah, visible, sir.
Okay, sir. So,
Please make it 100%, sir.
so very good morning to all of you. I am Dr. Dilip Kumar Yadav, and I am very thankful to Dr. Budati and Ms. Shilpa and all the team members associated with this FDP for providing me an opportunity to share and discuss about the AI and telemedicine in healthcare and the FDP AI impacts on telemedicine. So, the telemedicine is a tremendous research area nowadays, very grooming area, and it is a new and yet a lucrative concept, especially in India. Okay. So with the right marketing and government support, it is combined with the hard effort in the right direction, then this field can achieve a huge success. Like it is very beneficial for those people who are living in rural remote areas and struggling to access the timely good quality of services with specialized medical care. So it also has a potential to bridge this facility in healthcare in the remote areas, like in India, in hilly areas, as well as for remote areas, especially in villages, because more 70% of the total Indian population is living in rural areas, and 75% approximate doctors are living in urban areas. So this area is very grooming and lucrative. So we will discuss about it. So the telemedicine is simply a remote delivery of healthcare services with distance factor. It simply uses the information and communication technologies to exchange the valid information for the diagnosis and, and treatment and providing prevention of disease and injuries. It also helpful for the research and evaluation in continuation with the data collection from various kind of devices like IoT devices and various sensors, and that data can be beneficial for the academic and research, especially in education in the healthcare, as per the WHO report. So there is another term, telehealth or e-medicine, that also provide the remote delivery of healthcare services. These terms are interchangeably, but so there is some difference. So I will share that also. It includes the telehealth includes consultation with the specialized doctors and analysis and examinations over the telecommunication infrastructure. It also allows healthcare providers to evaluate, diagnose, and treat patients without the need of in-person or physical visit. So there is some aim of this domain also. It focuses on the diagnosis and clinical analysis by assisting in identifying, detection, and tracking of some diagnosis in public health issues. It also this area also enables medical experts to take control of a remote medical emergency, and it also provides non-medical as well as domain, and the trained persons are highly required in this area. So there is a huge opportunity for job in this area also. So the remote telemedicine is a way to design the platform that provides the portability in cost-effective manner. One more important thing is that this area must be equipped with the optimum bandwidth and required IT infrastructure for data communication, like audio video transmission or image transmission to send from patient to doctor and consult with the doctor. So such infrastructure is highly required. One more important thing is that why we need this telemedicine, because in the rural areas or various locations there is non-availability of facilities locally and non-availability of appropriate skills or appropriate doctors. Consultation is required and technology is available, but real experts are unavailable. And another thing is that travel distance, experts are for distance, they are not available at that location. So this ensures the delivery of right medical advice and at right place at right time. So it is very highly required. So we need telemedicine nowadays. As you know, I have discussed 70% of the population is living in rural areas and 75% approximate consultants or expert doctors are practicing in urban areas. So it's very difficult to access those or physically visit in a timely manner. So there is seasonal isolation in some tracts also. So there is a main difference between telemedicine and telehealth. In simple terms, telemedicine is sub-branch of telehealth. Telemedicine simply delivers interactive clinical services and performed at distance, but telehealth provides all the remote health related services. Maybe they are related to data collection, maybe education related, and clinical remote monitoring. And telemedicine really consists of to analyze with the teleradiology and examine the telepathology, teledermatology, telepsychiatry, and telecardiology. Nowadays telesurgery is also available and telerehabilitation. And telehealthcare consists of home care, nursing, and tele-coaching, tele-education, tele-rehabilitation, and tele-data collection, data analyzing. So this simple diagram clearly depicts how they are different. Like telemedicine is sub branch of telehealth, and telemedicine is again categorized in three parts, that is interactive patient care, that is online, and remote monitoring of patients, and store and forward means to store the data and forward it to the required destination or node for further analysis or examination according to the health care services and reports. So there are some features of the telemedicine to provide the consultation and diagnosis and treatment and monitoring and telepresence at online. And there are some examples of the telemedicine also, like mobile apps we can use, and various healthcare providers nowadays they have their own mobile apps. And telesurgery is another example, teleconsultation, that is also known as very popular nowadays, that is e-consultant, tele-rounding and telemonitoring and televisions also, that is also part of computer vision. With the help of computer vision and IoT devices like various sensors and various devices, we can easily capture the data like temperature of the body and skin body, and that data should be sent to the required node or destination, and with the help of that data the doctor will advise the actual treatment and prescribe the medicines according to the diagnosis results. So now why how the evaluation of the telemedicine occurs in the way of communications. For the point of communication, there are it can be categorized in three parts. One is point to point, and point to multi-point, and multi-point to multi-point. First one is point to point, where a single patient is connected to a single doctor within the same hospital or organization. And point to multi-point means one patient that from an end or a node communicate or consult with a specialized team of the doctors within the same hospital. And multi-point to multi-point, this will be preferred in critical cases, like several patients and connected to several different specialist doctors at different hospitals in different geographical distances. And another one is that the Indian government has supported and developed a network, that is National Rural Telemedicine Network in 2005. Comes under National Task Force on Medicines. There are various members who supports this domain, like health. These members are Health, Communication, Information and Technology, and Indian Space Research Organization, Indian Council of Medical Research, Medical Council of India, Center for Development of Advanced Computing, academic medical institutions and corporate hospitals, that consist of various private organizations who are involved in healthcare services. They are also associated with this network. So this network provides the utility services for the benefit of the patients, benefit of the healthcare delivery system and healthcare professionals. Also, they all together can interact and provide the better facility and better services to the patients. It also reduces the cost as well as diagnosis cost as well as time. The most important is time and cost. And one important thing is that the main objective of this National Rural Telemedicine Network is that it has the objective to provide the access and timely quality specialty based medical care to the people who are living in rural areas hilly areas, or you can say remote areas. It also reduces the rural urban divide in delivery of the medical care. It also reduces the time. It improves the diagnosis and treatment facility with the consultation of various doctors who are expert in the particular domain. It also mitigates the obstacles due to geographical isolation. It also it provides to continuous medical education, training, and research-based education also in healthcare professionals who are working in this domain. There are some models like we need website, smartphone, or applications or apps, and imaging test or interpretation can also be stored and for future in real-time environment, and that can be diagnosed and accordingly monitors the patient according to the outcome or diagnosis result. And after that, with the help of video conferencing or telephonic conversation, the doctors or experts will consult and advise the medicines to the patients. And then this National Task Force on Telemedicine, established in 2005, has developed various healthcare related levels, like in primary level, primary health centers or community centers. It is connected the district, all the hospitals of a particular district, and in level 2, district hospitals are connected to the state hospitals or national super specialty based hospitals. In level 3, state hospitals and national super specialty hospitals are connected to each other. At level M, with the help of mobile telemedicine unit, it covers rural areas and villages connected to the nearest at primary health care center and community health center or district hospitals. So in this way, the government has set up the network. We will also see this in forthcoming slides. But in India, the healthcare is mainly required in rural areas or hilly areas, because nowadays the super specialty services are required in the following areas, and like psychiatric based consultations have been investigated 34%, and dermatology related 29%, and nutrition based 4%. So we can see in which area the patients are communicating more. There are public healthcare delivery models provided by this network. It also have data at primary level, secondary level, and tertiary level, and at level M. There are nowadays with this network 242 medical colleges are associated, 205 dental colleges are associated, and these number of hospitals and private and public hospitals are associated within this network. And the main area supported by this network are teleconsultation, telediagnosis, tele-treatment, and tele-education, tele-training for the purpose of medical education, and telemonitoring and tele-support. So these are the areas which is supported by these model. Nowadays, India has this much area, and with this area, over 1 million population is there. 70% is living in rural areas, and such services are inaccessible in hilly, island, desert, coast, tribal areas, and villages who are too much far or nearby rivers. So how to so there is a requirement in India to set up a telemedicine based network that provide the facility. The government should provide better facility, and even the government is trying to provide and develop this network for providing the healthcare services. But in India, the best thing is that it has a strong fiber backbone for providing the internet facility and data transmission facility. It also has indigenous satellite communication technology for communication of the various devices, and various trained IT human resources are available in India, and nowadays pilot projects are successful, which was set up in 2005 and run within India. Nowadays, current efforts are mainly doing by the Department of Information Technology that provides in IT infrastructure related to this telemedicine, and Indian Space Research Organization NEC telemedicine program for especially for northeastern states, and Apollo Hospital, Asia Heart Foundation, state governments are also supporting it. So the telemedicine technology also supported by some other private organizations and healthcare organizations. So the basic telemedicine concept and working model we can understand in this way, like this one. So with the help of video conferencing, or the doctors communicate and provide the diagnosis result or clinical prescriptions to the patient. It also has mobile vans, e-vans, we can say. These are the district hospital, specialty based hospital. They may be for or in another country at any geographical location, so anyone can communicate with a particular doctor. So there are some benefits of telemedicine, utilities also there, like access to specialized healthcare services and semi-urban remote areas, early diagnosis and treatment within the time, the access to expertise in medical specialists. It also provides to reduce the physician's fees and cost of the medicine. It reduces the visit to specialty hospitals. It reduces the travel expenses and early detection of the disease and providing the prescriptions according to the disease. And it also reduces the burden of the morbidity. There are various challenges are available in this area, like perspective of medical practitioners, patient fear and unfamiliarity. People are urban people who are living in village are not having the knowledge, they are unfamiliar, they have fear in their mind, so they avoid such facility. So there is a requirement of awareness regarding this program at the ground level, especially in the villages. And financial unavailability. In rural areas, people are very poor, so there is a availability of the finance because the experts which are providing prescriptions and supporting this telemedicine, like Apollo hospitals, they are really costly for those people, and there is a lack of basic amenities, and there is a literacy rate and diversity of the languages, so it also plays a key role in the challenges. And there is a technical constraints also at everywhere the infrastructure is not available, and quality aspects and government is supporting, but there are various legal challenges are also there that is supported by the government as well as private organizations. Now we discuss the role of AI, ML and computer vision in telemedicine, how the AI, artificial intelligence, machine learning, deep learning and computer vision supports telemedicine. The AI-based two-way communication network and its infrastructure it provides and supports. AI needs machine learning facilities. AI and it highlights the diagnostic sensitivity and treatment. With the help of AI and computer vision, we can detect and track the disease remotely. We can see the suppose for example, we can see the report whether a particular patient is COVID positive or not, and some X-ray and cancer-related diseases can also be discussed through the AI and computer vision techniques. Machine learning is also helpful for providing or improving the system. The machine learning based various methods and algorithms are available that works on categorical data or continuous data of the patients to find out the disease and symptoms of the disease and behavioral changes and the biochemical and pathology related. So machine learning is very helpful in this area also. With the help of computer vision based or image based, we we can diagnose the patient through the online. For this purpose, Vansaha Mantham has proposed a concept for the knowledge-based initiative around medical virtualism to utilize in co-creating the machine learning delivery in medicine using AI. They have developed a platform and framework for providing the facility and service in the telemedicine. Nowadays, AI in medicine provide the virtual branch through the machine learning and deep learning algorithms. There are as we know, the machine learning is categorized in three parts: supervised and unsupervised, and reinforcement learning. The unsupervised is a technique that has no supervisor, no requirement of data pre-processing or training is not required. For example, to cluster the data and dimension to reduce the dimension, there are various algorithms like principal component analysis, k-means, and support vector machine. And in case of supervised, there we easily classify and predict the disease based on the available data and its type. So there is a supervisor, you can say. In this supervised training, we train the model, and based on the training we can easily identify or classify the data and predict the disease. So for the supervised technique, we may mainly use the regression model or decision tree. Decision tree is very important, helpful for classification of the disease, and sometimes random forest may be used. So for categorical data, the classification algorithms may be used like KNN, K nearest neighbor, logistic regression may be used, or naive-based algorithm may be used, and SVM can be used for categorical data in case of supervised learning. And similarly, in case of unsupervised learning, the association is required in the analysis of the data. For this, a priori algorithms will be used for unsupervised data, or FP growth algorithm or hidden marker model can be applied. In this case, in case of unsupervised learning, the data doesn't have category, or it is not labeled. So that there is no requirement of training, but in case of supervised, we provide the training to the input data, and data is labeled or have some classes, and that classes are provided through the classification of the data can be used. But in case of unsupervised, we use the clustering to make the clusters, because we don't know the level of the data. So if there is data that has no previously defined category or label, so in this case, if data has no label or it is not categorized, then we can say unknown data. For unknown data, there are algorithms that teaches us itself to classify. We use mainly clustering, and to reduce the data dimensionality of the data will reduce. That can be reduced with the help of TC also, and after that clustering is helpful for unknown data that belongs to unsupervised learning. And reinforcement learning provides the iterative operations for a specific domain of problem. So the data is categorized in various format, and similarly telehealth tracking disease online. The working model is like this. Suppose this is a patient, and patient is sitting in front of the camera, and there is a software where AI based algorithms or machine learning based algorithms are there, which interact with the patient and find out the symptoms, and based on those symptoms, the machine learning based algorithms or software prescribes the disease available in the person or patients. And it can also work in remote environment through the mobile apps, and for further states the medical advice or pathology weight or detection of cancer related diseases. The experts will consult and advise the prescribed medicines according to that, and treatment they will provide through the online services. So this is a basic working model and how it works. Similarly, the impact for detection and tracking, and as well as classification of the disease, we can understand through this diagram also. And similarly, with the input, suppose the particular person has symptoms of chest pain and palpitation and cough, and with the biochemical analysis, he found some problems related to the urine or blood, and similarly other features the software will assume. Machine learning algorithm consider like age of the patient, gender of the patient, whether he is smoking or drinking. Such features he will use. Then we apply some machine learning based algorithm with, for example, decision tree, and based on the decision tree you will diagnose whether the result is positive, negative, or uncertain kind of things. So, and with the help of cancer classification, suppose skin cancer, with these symptoms doctors can easily advise and prescribe whether it is a cancer or a fungus on the screen. So the classification is required. All this such kind of classification are done with the help of machine learning algorithms. So machine learning is a very powerful tool, and for example we have some symptoms, and based on those symptoms and analysis result as well as features related to these, the decision tree will apply. So decision tree easily provide whether it is a cancer, the spot on the screen is related to the cancer, or it is a fungus on the skin of the person. So similarly there are various other models which works in effectively in different domains, like with the help of robots. There are various surgical treatments are done, and the doctors provide the prescribe the instructions for the surgery, and robots are doing according to the instructions they achieve. Means the input data is provided by the doctors and experts, and accordingly based on the data, the robots accomplish the surgery. Similarly, the use of robots to monitor effectiveness of the treatments, and they are communicated in this ways. Suppose a patient came for the in front of physiotherapist and provide his data and symptoms. Based on that, the physiotherapist provide the medical prescriptions, and simultaneously the robots through the telemedicine also provide such kind of sorry also provide the prescriptions based on the symptoms and data captured through the by the patient. And there are some growth drivers of AI in healthcare, especially in telemedicine. It increases the individual healthcare expenses. It may be used because imbalance between health workforce and patients. So in that case, due to imbalance, we need the AI based healthcare system, that is telemedicine as well as telehealthcare. Similarly, increasing global healthcare expenditure, nowadays companies and government are trying to expand or invest in this area also, as there is a requirement of the various doctors and nurses in this domain. So there is a huge requirement of technicians and technical staff in this area. With the report of WHO, the number of vacancies for nurses will be 1.2 million by 2020 and 1.5 million by 2025. So there is a huge requirement of medical practitioners, technicians and nurses. So, and with this, based on the patient will communicate and with the collaborative hospitals and provide the clinical analysis of the data and result to the intelligence system. Based on the data, the prescription is provided by the doctor, whether the particular patient which kind of medicine is required, or surgery required, or only medicine is required. In that case, with the help of the result and diagnosis of the data provided by the medical practitioners. So it is very helpful. And even in India, the hospital administration like Arvind Eye Care system in Madurai, it provides the facility of mobile van for transmission of the patient detail and images related to fungus, or transmission of diagnosis details and treatment through the satellite system. So this university is providing such kind of facilities. And similarly, the AIMS also provide the mobile van facility through which we can communicate and diagnose. It have all the infrastructure related to diagnosis devices. Sometimes it is especially in rural areas where like in 10-20 kilometer areas, there is no patient for 6 months for such kind of facility, so the resources are wasted. So it's simply a wastage of resources. In such cases, it is a very big challenge in front of the government as well as the associated members. And one more example is given by one of the doctors of AIMS, New Delhi. So this is way they will take the data through a communication network, and based on that data they will prescribe and also give the bill and other charges. Like this is basic working model that is provided by AIMS New Delhi. The AIMS New Delhi also provides teleconsulting center, like various patients are not able to attend physically. So AIMS has set up a department for teleconsulting center through which patients can communicate, and expert doctors will provide the advice and prescribe according to the diagnosis results. So there is a term teleradiology. That teleradiology is simply provide rapid diagnosis and report, and for within a time period that required locally, and transmit the data with the help of radiologist to anywhere in the world. So with this facility, the MRI based CT scan, ultrasound and conventional X-ray images or computerized radiography based images can be transmitted from a particular location to any of the location throughout the globe. This teleradiology also has the strength to utilize the workstations and to deliver the data with high resolution, because the images of MRI, CT scan, X-ray are required with high resolution. Then an expert doctor will prescribe the medicine. Like in case of teleradiology, the X-ray images will be shared, and the doctors will or experts will interpret and consult the required prescription. And similarly in telepathology and teledermatology and telepsychiatry. So these are the departments like teleradiology. The example can be understood with this: telecommunication is required, and teleradiology and informatics like IT should support in this area. It provides the infrastructure related to the satellite, mobile network, security and modalities of medical imaging and document packs for image processing and analysis of the image compression, which techniques will be used for compressing the image that should be decompressed with high resolution, with high quality. So these are the images, and with this, in this way, these are the examples through which we can acquire the benefits of telemedicine, like radiographic, that provide and they diagnose and treat a wide range of medical problems using X-ray. And similarly in computer tomography, that is helpful for the bone, spine or joint abnormalities and bone joint structures and joint pains and tissues are available. So it is helpful in this case. Similarly in case of tumors, MRI is very helpful to determine the cause of headache, nervous system problems. So MRI is helpful. Similarly ultrasound or sonography to find out the gases problem, gallstone or stones in the kidney or in other body part and taste. And sometimes it is also helpful for identify the new, whether the upcoming baby is is male or female, which is banned in India, and also helpful for the identifying the health of the baby, and accordingly the doctors will provide the prescription to the mother. and nuclear medicine imaging is used. And similarly in detailed mammography, another example, based on these symptoms in case of X-ray, CT scan, ultrasound, nuclear and MRI. So with these symptoms in these areas, these are the data. In this way data will be generated, and based on this data the machine learning or AI based algorithms will prescribe whether a particular patient is having headache or fever or having stone or cancer or other disease. So there is another technology that is digital imaging communication in medicine that provides support for storing, printing and transmitting the information, especially in terms of medical imaging using TCP/IP protocol. The most of the data is in JPG format and it uses lossless compression and length coding, and pixels are having high quality. And there is another technology that is inbuilt with this DICOM, that is picture archiving communication system that provide the facility for acquisition of the data imaging system and to store the data locally or on the network. So the PAC system is there that provides the facility. This is the format through which, for example, the data can be transmitted and examining the report. So such kind of bandwidth is required, Wi-Fi, how much time it will require. So it is also very important in terms of infrastructure if such kind of data will be transmitted. For example, an image is having this much size in case of digital mammography, then these number of bits, and for example per second 5 images 30 images are going, then for 1 hour how much number of 3600 of images will be transmitted. So in this case huge amount of data that represent the big data will be generated. So how much data is required is also important. So best practitioners will provide such kind of things, they support it. And the Wi-Fi is required for transmitting such data. The bandwidth is also required, how much bandwidth is required and as of the network. So for the data transmission the network infrastructure is highly recommended and very important in terms of transmission of the data, in terms of video or images or online communication. So in case of medical imaging, various physicians provide the human body and clinical purposes. Like in medical image processing we have seen various examples. These are also few examples, like how it simply captures the images and improve the quality of the images with the help of pre-processing techniques. Like filtering techniques will be provided, noise removal is there, or various filters are like Gaussian filter, Gaussian noise should be removed, or some hardware related noise, or paper and salt noise. There are various kind of noises out there. So enhance the normal essence. It also helpful for the determination of the abnormal essence. In this way the image analysis will be done, like to provide the pre-processing, then data reduction for the transmission of the data from one node to the destination, and then feature-based analysis is to provide the features, and based on those features the AI and ML or deep learning plays an important role for providing the decision with, and based on that decision the doctors will prescribe the exact medicine. And in real-time environment there are various open source software for the medical image analysis which are helpful for telemedicine, like image 3D slicer, ITK, Genent, Osirix, micro Tycom, free supper, clear canvas, and NumPy, SciPy also have the libraries to provide the decision-based analysis. Like these are the tools, and there are some various barriers faced by the telemedicine, like when the patient or physician will accept the request, and funding or reimbursement issues came, convenience time or suitable time, and then some legal issues are there that provide in contract or legal services with legal rules or guidelines from the government, so that a particular patient who are unfamiliar with telemedicine, they can consult with the and they take the benefit of this. There are another examples provided by the WHO in medical imaging through mobile phone, and another example like provide ultrasound imaging with a startup. This is another example for developing this application. The Professor Richard got this amount from the Microsoft as a reward, and recently 2 days earlier, Professor Ajita Ratani, who is assistant professor of computer science at Wichita State University, has been awarded $2 lakh from the NSF for studying the fairness in facial recognition software she developed. So various organizations are supporting.
ഓണാവുന്നില്ല ചാർജറിന്റെ എന്താണ് ഓണം ഇരിയില്ല.
Hello. There is some current scenario. In 5 minutes. Yes. In current scenario, the government of India is supporting in various ways, and various states like UP, Rajasthan, Maharashtra, and Punjab and other have implemented the telemedicine. So, in current scenario, 8 states have invested 253 crores in 3 financial years, and this was as they also provide the infrastructure, manpower, and implementation and various methodologies and models adopted by the states, and these states propose interoperable medicine solutions with integrated diagnosis services, and they also supported with Ministry of Health, Family Welfare, as well as National Health Ministry, and these are the observations on the state telemedicine projects, especially in Rajasthan. This much the facility is point-to-point mod, and this 100 centers on rental mod and call center is set up. 26,000 per month per center has been invested, and this much amount total the consultation cost is this one per patient. So it is really costly in Rajasthan because people are not trusted, so the cost is really high. Similarly, in Himachal telemedicine project, there are 25 centers with this Parimala Swasthya Care as implementation agency, and there is also call center facilities in every state. So here is also per consultation cost comes 750. Similarly, Himachal telemedicine project, there in Maharashtra telemedicine project, and Jharkhand telemedicine project. As we see the difference in the per consultation cost, the people living in the Jharkhand are really poor. They also visit, so the cost of per consultation reduces as compared to the other states, and these are other year-wise funds provided and approved, and total expenditure in the state, that is in each state the data is given here. This data is taken from Ministry of Family Health Welfare, and there are various problem statements of the government of India who had developed this telemedicine project. And pan-India telemedicine concept, the main concept of and spoke model is adopted, and it is connects the state medical colleges, district hospitals, and high quality hub is used. Infrastructure should be high quality. It is categorized in 3 layers by the experts. And CDEC also have CDEC Mohali also provide e-Sanjeevani telemedicine applications, and this is a simple high level architecture that has been we have discussed earlier also such kind of models and architecture. This again a picture provided by WHO that based on the video conferencing, the experts will diagnose and take the X-ray of the patient and provide the prescription to this. According to the WHO, the teleradiology is used in these and zones like Africa, Europe, Americas. So this report has been developed, data provided by the WHO on telemedicine, and similarly for telepathology, the data is like this: how much countries are using this service in case of pathology. Similarly, in case of telepsychiatry, WHO, according to WHO data, these are the zones which uses the telepsychiatry services. Like in Americas, 34% approximate are using telepsychiatry, and similarly South Asia there is 37% approximate. And one more important, the countries which are supporting national telehealth policies, but in India it is showing in blue color, the India is supporting telehealth services, and the countries which are supporting, they are given here. And the final conclusion is telemedicine for real and real-time telemedicine interventions are really practical, and it has potential to reduce cost and save lives, and it is a concept and tool. Its use is really limited, but according to the imagination of the person, it can be generated at and expands at any level. So it is really helpful for our life, and thank you all of you for listening. Hello. Hello.
Yes, sir. Any doubts from participants?
One more important thing is I want to share with all of you. The telemedicine is a term that can be bifurcated, like tele represent the distance, especially in Latin word. It's a Greek word. Tele is a Greek word that represents distance, and Another word is medri. That is a Latin word that means to heal. To heal. So both are combined together. Telemedicine means healing the wire, means healing through the wire. So the term represents the to heal the diseases through the wire or wireless technologies. The term are really too much old, but how they are connected in this way. So it is really helpful for the healthcare services, and AI and ML are really suitable for diagnosis purpose. Yes, sir. Thank you all of you, and thank you Dr. Budati and Ms. Shilpa and all other participants. Thank you so much.
Sir, thank you very much, sir. Thank you for accepting our request and giving a good lecture on AI and telemedicine. So how detection is coming and tracking is done in. So thank you very much, sir.
Okay, ma'am. Thank you. So should I leave?
Yes, sir. Thank you, sir.
Okay, sir. Thank you. Thank you.
Participants, after filling the link, you can join the session at 11:30. You can use the same link for the next session also.